Okay.
Good afternoon, everyone. We're going to give everyone just a few seconds to trickle in, and then we'll get started. We can start at 12:01. All right, I see the trickles have slowed down. That's great. We'll get started. I want to make sure that we use up the time with the speakers and not waiting for everyone to log in. So there's a bunch of housekeeping to do, and everyone else can trickle in as we get that out of the way. So as I said, good afternoon. Welcome to the Greater Illinois chapter of HIMSS. This is our virtual event. I think the last one of the year. This event is titled Nurse Informaticists, Their Roles in Mobile Health Development. My name is Maria Phillips from Imprivata, and I'm a member of the Educational Programs Committee here at GIC HIMSS. I would like to go over some of these housekeeping notes before we get started. And keep in mind that at any time you can submit a question or chat if you have any technical issues. So if you have any questions relating to the webinar itself, please locate that Q&A box and enter your question. We will answer as many questions as we can throughout the program if it's applicable to what is going on, as well as at the end. If we don't get to your question in the time allotted, please do not fret. It will be answered via email. Please keep in mind that this webinar is being recorded and will be made available to the GIC HIMSS membership. Attendees are not visible to one another unless they opt to chat everyone. And by attending, you consent to these conditions. We have a great panel assembled for this program today. Any statements or opinions made by the speakers are their own and do not express the views or positions of their employers or affiliated entities. After the webinar ends, you will be presented with our evaluation survey. Certainly, we appreciate any feedback that you may have, but if you are requesting continuing education credit, you're required to complete the evaluation. After you finish the survey, a certificate will be emailed to you by the end of the week. Again, I welcome you to this event. Thank you for taking the time out of your busy day to participate. Let's talk a little bit about our sponsors. We would not be here without them, and we want to thank them for their support. These education events are very important, so thank you all for your support. With that said, if you would like to come to any other events, if you always are tuned in, then you know this. If you're not, then you can always go to the website and register for any upcoming events or check what's going on, whether they're in person or virtual. We love to have you, so definitely keep in touch. Other ways that you can reach us are listed here. All right, so I'm going to stop sharing my screen so that we can get started with introducing our panelists. So today's program is going to give us a lot of information about nurse informaticists and clinical nurses to join interdisciplinary teams and talk about design and development and implementation of mHealth technologies. Our two speakers today are distinguished and renowned. You may recognize some of them, one of them at least. And first, I'd like to introduce Dr. Melissa Breth, the Nursing Excellence Data Coordinator for Northwest Community Healthcare, which is a partner of North Shore. She is a nurse informatics leader who supports nursing excellence, drives better clinical outcomes, and improves delivery of care through technology. In 2018, Dr. Breth earned her doctorate in nursing practice with a focus in healthcare informatics and developed an interest in mobile health technology. She co-chairs the Mobile Health for Nursing Work Program and currently serves on the board of directors for GIC HIMSS as immediate past president. Dr. Tammy Wyatt, endowed Torchbearer Professor, Associate Dean of Research at the University of Tennessee College of Nursing, and co-director of the Health, Innovation, and Technology Simulation Lab, the HITS lab is a mouthful, is a nurse scientist and entrepreneur who works very closely with engineers, graphic designers, and design thinking strategists to create innovative solutions for healthcare. Dr. Wyatt and her collaborators are currently conducting research on several mobile apps used in various settings and are always seeking opportunities to improve healthcare experiences. Dr. Wyatt co-chairs the Mobile Health for Nursing Work Group and the Nursing Knowledge Big Data Science Initiative with Dr. Melissa Cerna-Breath. With that, I'm going to hand it over to our panel.
Thank you, Maria. So just a preview of what to expect. We'll be going through why we're talking about this content, consulting the literature and the industry, as well as looking at what the mobile health development dream team looks to us, and then getting involved. So first, beyond our introductions, and what it was mentioned that Tammy and I are co-chairs of the Mobile Health for Nursing Work Group. That is part of one of 10 other work groups consisting of the under the umbrella of the Nursing Knowledge Big Data Science Initiative, which is a group that has been meeting for the last 10 years and meeting at an annual conference in University of Michigan. Please ask us more for information about that. But our work group focuses on mobile health for nursing, and we have about a dozen others that we represent here. Looking back at nursing informatics history, we think about the electronic health record and focusing on the workflow and the usability, change management, and continued work now looking at coding terminology, standardization, retrofitting for interoperability, and actually a lot of retrofitting. Nurses were consulted more so because we use the records so often, and more so we're pulled in to customize and implement and work on the workflow. Whereas, and if you remember, that the electronic record really is, we took that piece of paper and we tried to recreate it electronically, which doesn't really work. Doesn't that lend towards interoperability of data, the data flow, and also the interdisciplinary collaboration? So with that in mind, so much work goes into terminology, codifying everything so that we can be on a level plane, so that we can create that interoperability. And looking at the whole experience, nurses should have been at the table to contribute to the design and not just the implementation, like customization and then the retrofit. And when we think about mobile health, the industry is in its infancy, and we have that opportunity to be at the table to contribute to the design. As we think about the product life cycle, there are many models out there, and we use this one with the 7 steps from planning, requirements, and design, prototyping, and then software development, testing, deployment, operations, and maintenance. Very similar to the software development lifecycle that you may be more familiar with. In this model, our assumption or our hypothesis is that nurses really have more experience in the planning and the requirements gathering, identifying what the requirements are, but not as much in the design, prototyping, stages 3, 4, 5, somewhat, being the design and prototyping, software development, and testing. And then we see more of an experience in the deployment and maintenance of operations. So we're focusing more on the steps 3, 4, and 5 of this model. And Tammy will talk about how we looked at our hypothesis that we see from our experience that nurses were more integrated into the early steps or the later steps in the implementation. But what does the literature say? Tammy?
Thank you, Melissa. Hello, everyone. I'm happy to be here on this sunny afternoon, and sunny is a really warm welcome because we had rain for a solid 7 days. So I think it's important, before I get into the literature, that I give a little bit of background about how we came to this thought that we had to do a scoping review to better understand the nurse's role. Our ultimate goal was to be able to talk about how the role of a nurse and a nurse informaticist it is integrated into mHealth, especially given that mHealth is new. And we certainly don't want to find ourselves in a similar situation that we found ourselves in with electronic health records, where we were forced to really accept a lot of decisions that had already been made. And so as we were talking about writing a white paper to explain how nurses should be involved, we realized that we weren't quite sure if what's practiced is also in the literature, and we realized that we also did not know what was in literature. So after mulling around with this for several months, we determined that we needed to not only evaluate the literature, but we also needed to evaluate what was actually occurring in industry, and then any information that we could find through internet searching, such as websites or are nurses publishing information on through proceedings or through abstracts or from poster presentations. So we are actually doing a really thorough evaluation of that. But what we have completed is our current literature review. So let me start by telling you, there's over 350,000 mHealth applications, and you're probably not surprised about that. And I bet that there's even more than that. It's hard to get a handle on exactly how many there are because they proliferate every day. What we have learned is that initially the mHealth applications, they started off being products that helped people keep up with their healthy habits, logging and tracking. And now they have just started to move into the area where a lot of mHealth applications are helping those people with chronic diseases manage their diseases, such as diabetes or any kind of cardiac health conditions. There's also a good many of the mHealth applications that focus on mHealth and social behavioral health. So why is it important? Why do we believe that nurses should be involved in some of these application development? Is, I think, probably first and foremost is that really the nurses are the ones that know the needs of patients better, and sometimes even better than the patients themselves. So we offer a holistic approach. We know what's going on. We spend more time with patients than anyone else does. And so our argument at the very beginning was, surely nurses are involved in the planning and development of applications that occur for patients. We perhaps found that, but one of the messages that I would say overall is that I think our messages, what we learned, is perhaps more in what we didn't find than what we found. Because if we found writings about nurses and their role, that meant that there was practicing. There were some folks that were practicing that, and they valued the nurse's role so much that they wrote about it. Now here's the story. We searched 14 databases, and out of 14 databases, we found just over 2,000 articles. Of those 2,000 articles, we narrowed it down to 189, is that what 189 that actually discussed the role of a nurse in the development stage. So a lot of those articles were talking about how the nurse was involved in the rollout, how the nurse was involved in gathering information about the rollout, et cetera. But to really talk about the nurse's role in the development, there was only 189. Once we reviewed those 189, many of the articles didn't necessarily describe more than just using the word nurse or healthcare. And that got us down to right around the number of 60s. So when we finished doing all of that, we actually we extracted data from about 60 articles that described in some way the nurse's role in development. Not all of these articles were studies. In fact, it's probably about half and half. And those that were reporting on studies, they were always reporting on usability studies. Sometimes the article was just a usability study. Other times the article was reporting on usability and feasibility, where they were looking to see if this was something that could be used. That's what we discovered overall. So now let me get into a little bit more of the details. Melissa, is there another? This is it. This is a second slide. Okay.
Yep.
So because of the articles that we found where a nurse's role was described, it's not surprising that those articles often reported the role of the nurse as being pretty comprehensive. So we were a bit surprised to learn that nurses were involved in the planning stages. They were also involved in the requirement stages and the design and prototyping stages, as well as some of the evaluation stage. That surprised us initially because we thought that we would not find that we would instead find that they were really involved in just the testing and serving as subject matter experts. But remember, we found very few articles, 14 databases, only a couple of thousand that even mentioned anything about nurse. So that's why the story might very well be, the remaining articles that either exist or those articles that don't exist at all that reflect the real nurse's role, which is either absent, never involved, or that they're just involved in the evaluation piece. So overall of these articles, there was a focus on all of the phases that Melissa just described in our product development phase. One of the things that we learned is that this is not, nurses were more involved in applications that were built for nurses. So of the articles, 44 of the apps that where nurses were involved, they were actually developed for nurses. Second under that were apps that were built for a patient or someone that is interested in health, and that was 34. That was impressive because one of our arguments was that we do know more about a patient, and in fact, often more than even what a patient knows. So of those few articles that we did find, there was acknowledgement that a nurse really must be involved in the applications that are built for patients. Third to that would be applications that were built for non-nurse providers. We're talking about physicians or any of the other healthcare staff that might be using some type of application. We also discovered that of the reports, the articles, we saw a trend, and the trend was exactly what you probably would predict. The early applications, by the way, we chose articles that were just within the past 5 years, and we saw a trend towards more simple app features to more sophisticated app features. But even at this moment right now, any articles from 2022, the most sophisticated are not that sophisticated. We just simply aren't to that level just yet. So when we saw some more complex mHealth applications that might be integrated with other systems, it was usually integrated with either some form of communication, either integrated with email, text messaging, a blog board, some way to communicate. And then we also found, second to that, is that the mobile health was often integrated with either the EHR, EMR, or a portal. So they were gathering information through the portal to get to the actual patient data. Overall, we discovered that most of the users, when they're using the mobile health applications, they're using it to share, to either gather information or share information with others, which also indicates that reciprocal sharing of information between some other system and an mHealth system. Not happening real often, but when it does happen, it appears that nurses are involved. What we did not find in any of the articles is a nice description about why a nurse informaticist would be involved or how they would be involved. So they were often involved in the planning, but they were involved in the planning in the what's forward facing or the front end. So they were involved in planning what kind of content information needs to be available, how would you navigate to it, what would I do with it after I received it, but very little to no, well, there was no discussion whatsoever about the back end, how the system should be integrated, what data should be collected and shared, and does that are those data compatible? Are there standards that are in place? Which brings me to another important finding that that we report on in an article that we're almost finished with right now, and that is standards for across the board, which is really quite interesting because by virtue of the word standards, it implies that folks are using the same guidelines when they are building their applications, and we just did not find that. In fact, of these articles that were reporting their development phase, most of them were claiming that they use standards that were based on the content. So they might be using evidence-based protocols, and that's what they were calling standards, as opposed to the very few articles that described a type of tech standard. And that was not common, nor were there one or two standards that were used. I'm bringing this from my memory, and I believe that there were 14 different standards that were reported. Now, what's important to note, though, is that when we looked at these articles, we also found that there's far more written about a nurse's role in Asia, in Europe, and Latin America than in the US. So perhaps there is not as much focus on standards that was influencing some of the results and the findings that we came up with. So the message there is perhaps we need to watch what's happening in those countries to determine what the next stages might be, or how nurses are becoming more integrated into the full process, or even how they're not, which is what we fear is happening here in the States. I think that Melissa has already talked a good bit about why we valued that nurses needed to be involved. We believe that nurses have more knowledge about what's often needed and shared with other providers. They often know the full complexity of patients, and this is not just acute care, inpatient patients, but also those that are outpatient. I suppose we just feel like we're really knowledgeable and tooting our own horn and feel that we need to be involved in that. So overall, it was really nice to see that nurses were being used to validate content. They were often the subject matter experts. They were often used in later stages after a prototype to review the content and ensure its accuracy. Overall, I think it was really telling that nurses were involved in many of the stages that we did not anticipate. But I want to emphasize again, I'm not sure that's the story. It might be that the story are all the articles that have not been written, or all the ways that nurses are involved, but we're not reading about it because it's not valuable enough to be published. We want to change that. We think it's really important that we begin sharing what how we're involved, how we believe that we need to be involved. That's the only way that we can get to some standards. And I know that we all believe that there needs to be standards, not only in a technology based development, but also any type of standards about a team, what a team should look like, and the processes that should be involved in the development. I want to stop there with the findings and just say that as a result of the scoping review results, we also are still looking at industry, what we can learn from industry and the practices that are not found in the literature, and then also what we might find in other little nooks and crannies on the internet. So Melissa, could we go on to the next stage? Next screen. Okay, so here we've I just said this, I just summarized this. We will use the scoping review data to help guide the search that we're doing through the industry and the internet. So we've already written up protocols about how those searches will occur. We also intend to develop a survey to information about who is making up a development team. When does it happen? How is all of this occurring? And where would we find that information? Because it's not in the literature. All of this will culminate into a white paper that is written to help a lot of different audiences know what to do, how to follow. So information for industry about why to engage healthcare professionals, specifically nurse informaticists and nurses, and then a section for nurses about why do you need to get involved? How do you get involved? That's the ultimate goal. Melissa. So now I want to just briefly start about what's in the industry, and then Melissa will follow that. I want to tell you about, I believe I want to tell you about one app that the lab that I oversee built. I think that's the next slide. Yes, so in the lab that I co-direct, we build multiple applications and health applications. And although the system that we use, the model that we use may vary a bit, it always is iterative. We always spend far more time in the planning stage than we do in the actual workup stage. And we engage the end users throughout the entire process. When we are developing tools, we have a very eclectic group, an interdisciplinary group. We work with the engineers, instructional designers, programmers. We work with subject matter experts and nurse informaticists to help us understand needs of the application and how it might be used, not just the day that it is produced, but we try to forecast how the application may need to evolve and grow so that we can expand and maximize the application. We tend to use some type of agile system, just about always. And for this one app that I'm describing here, we use a similar process that falls underneath an agile system. Because we're in a university setting, we have the luxury and the requirement that we spend a lot of good, valuable time in the evaluation process. And so we do engage others, end users, others in the evaluation process and development process. And so we often call that participatory action research or participatory action approach, where we're simply getting valuable feedback from the end users in multiple stages of development. And so that leads me to the next slide, which is really a description of the differences between an iterative and incremental development stage versus a sequential stage. I think it probably stands to reason that if you're gathering detailed information from end users multiple times, you're spending a lot more time in the planning stage. So it may be that you're gathering information from the end users about first the content, type of features that you need, work that out through storyboard and wireframes. Then you revisit your end users again to help gather information about, does this make sense? Is this something that is workable? Is this what you envisioned? Get more feedback, and then you begin developing your prototype. But that's not the end. You continue to evaluate in an iterative or incremental process. The benefit of sequential is that you get to a prototype really quickly. And so often in industry, that's exactly what happens, because you don't have the luxury of working on an academic clock that moves really slow. Instead, you have a customer, they want a product in 6 months. And so you're dedicated to getting something, a deliverable in place right away. That often means sequential, and that it's a risk, because the risk is if you haven't engaged the end user at multiple places, your product may not be what you intended for it to be, or it might be what you intended it to be by the customer, but the customer didn't understand what the real need was. And so there, I turn it over to Melissa.
So Tammy, do you think that the sequential process seems very linear, and you said it's more straightforward? In the business, do you think that more academically structured or academically built apps follow the agile, whereas if we were to talk to somebody that's not associated with a grant or a academic setting, would be more apt to use the sequential process?
Yeah, I don't think that is a solid, hard rule, but I do think that that's exactly what you'll find. In an academic setting, everyone is conducting research. And if you're conducting research, that means you're gathering data. And the way to gather data during mHealth development process is from the end user. And so I think you're going to find that in an academic setting, they're spending more time gathering data and analyzing that data and building on it. So building the next phase, as opposed to a sequential where you're out of the industry and someone has contacted you and they want a product. They have an idea, they want a product. You're to deliver a product to them in lickety split, whether it's 3 months or 6 months or 9 months. You don't have the luxury of spending a lot of time in the planning period. You have to get to it right away. So yes, I do think that you see more sequential processes in industry versus a more iterative and incremental process when you have the time to do it. It's a difference between, well, textbook versus reality.
So then, do you work in 2-week increments when you're using the agile methodology?
In 2-week increments?
Yeah. What's that? What are those iterations? What does that time-wise look like if you had time?
Yeah, it's not 2 weeks. In the academic world, you can't plan a meeting in 2 weeks. So, it requires a lot of coordination. So if you are gathering information from end users, you have to coordinate when they're available. And you have to find those that might be interested in helping with the design. And you'll usually find some real eager folks that would like to see something, especially if they have a particular problem and they believe that this deliverable might help solve their problem. So an iterative incremental stage, it's often 3-stage. It could be 5 stages. And those stages are first the content. You're getting information from the end users about, well, what if you had this mobile app, what is it doing for you? So the functions and the content, what is it doing for you and what are you getting out of it? And then after you've gathered that information, then you come back with a storyboard or often wireframes where you're showing them what the features are, what it looks like, how it functions. And that process takes a long time. Now, if you're in a shop that can dedicate 100% of their time to developing this, it's not going to take nearly as long as if you're in an academic setting where you don't have the luxury of any researcher spending 100% of their time getting to deliverable. So in an academic world, it's going to take a year to a year and a half to develop any application. And it just won't take that long. Take half the time in industry.
But it does sound like through the iterations, you can provide your interested parties can provide valuable feedback that could be implemented into each iteration.
Exactly. And it is, the thinking is this: the more time you can spend on planning, and the more people that you can involve in the planning user, you're going to get the product that you need the first time, not the fifth time. So in reality, iterative should be less costly, because you're getting to the actual real prototype much more quickly than if you're doing sequential and you get your prototype and then you have to rebuild and get your prototype again. So cheaper, should be less costly, it takes a little bit more time in the planning, but anytime that you spend more time in the planning, the whole purpose of the planning is so that you can get through the actual steps in a manageable way.
But it sounds like more opportunity for partnership.
Absolutely.
Great. So within that development team, working with different interested parties, we put together this kind of visual as far as who we would think should be on our dream team. You would have your project lead to make sure that everything's working and sticking to the schedule and processing. You have your programmers, of course, and your designers, as well as testers and researchers, depending on what your subject is. You want the information to be tried and true and evidence-based. And then we also have to keep our end users in mind. And end users could be from very different perspectives. So when you're developing, thinking from an end user perspective could be automatically think about the patient or the consumer who's going to be using and managing their health or learning about health. But also those end users are educators and nurses and physicians, supporting the work that they do, and also communicating and providing support to the consumer on how they can manage their own. Subject matter experts, be it the topic itself or also the way and the functionality of the app. So that subject matter expert could be deemed in different terms as well. And then instructional designers and nurse informaticists to have that forward-thinking vision on the back end, as well as the interaction from the front end, working with patients and consumers. And then gamification experts, because we find that that with competition or the things that are going to keep you adhering to the app and staying with the app longer are those things that make it fun and like a game. We found positive effects in that sense for most apps. As a nurse informaticist, throughout the whole life cycle, what roles do we see? So in the first, as in the planning stage, really looking at as an innovator actually creating the app, or program manager in the role of managing a team that will be implementing the product, developing, or a consultant from the big picture perspective. So having the end in mind, and also ensuring that you have the right people in place to continue through and be successful. Requirements is the second stage. So working with subject matter experts, advocating for standards, scalability, functionality, feasibility, looking at what's the workflow that you intend from the front end before even beginning. And then looking at what requirements for the technical aspects as well as for function. The third step, design and prototyping. Advocate is really the biggest role, for standards, as well as representing the patient and consumer, and also user-centered design expert. So incorporating those theoretical and methodical processes to development and designing to your prototype, which this could be multiples in this process. And then the fourth step of software development, developing the design model controller in the actual app. And then testing, so project manager, organizing and processing that testing process, testing for usability from that end user perspective, looking at the workflow as well as the heuristics and such. The subject matter expert actually being the tester could also be another role within that stage. Deployment. So this we're more familiar, project managers, workflow designer, trainer, educator, oftentimes multiple roles within that whole process, and then support in that deployment stage. And then the last is operations and maintenance. So oftentimes we think about with software, we think about the go live, and then oftentimes the operational processes to keep it going are afterthought. But this is very important for keeping up and making sure that still applicable, still usable, and using the customer as an informant to provide that feedback on how to improve for that process improvement of the software. Distributing updates, being the one to actually ensure that the product is up to date and working, still usable and applies to your purpose. We have a question here. Do security and privacy or other compliance folks like DEA, ADA, etc., fall under SMEs? If not, where do you envision them participating? That's a very good question, especially since for cybersecurity, a lot of times people don't think about the device. And if you're in an acute setting, all those devices, the pumps, tablets, things like that, are all possible ways in which the security could be at risk. So including a DEA or ADA in your process of looking at subject matter experts, what are the standards that should be in place, as well as the content that is being reviewed or displayed should be included in there if it's applicable to your content. A lot of times they are not, though. There is a way to review applications, medical applications, that was published by, I think in 2017, that actually does recommend that you look at who the developers of the content were to see what standards were used, as well as the evidence that the basis for content that they're providing. Tammy, do you have any thoughts on that?
Actually, the slide that you're at right now is a nice slide to be answering this question, because a subject matter expert absolutely doesn't have to be necessarily just the medical content. It might very well be that you have a subject matter expert on Disabilities Act, and there actually are a lot of requirements to ensure that you're ADA compliant. And that would fall underneath the requirements section. So right after you begin the planning and designing, then you need to make sure that you're addressing all the requirements. You sure would hate to miss some of those pertinent requirements once you start designing and prototyping. So the answer is yes. The ADA, anybody that will, any person, any organization that is overseeing compliance issues or standards should be involved in the requirements stage. They may be called subject matter experts or something else completely different.
Thank you. So Tammy, how does what nurse informaticist get involved?
Well, funny you should ask, Melissa. So we can only report our own experiences, and there's several ways that we have been involved, and also some of the ways that our collaborators have been involved. I think that probably one of the most difficult things for me has been being able to secure funding. What I have discovered is that the typical healthcare funding agencies, they want to fund your ideas when they become implementation or intervention type studies. So they don't want to fund your build. They need for you to build your toy, build the sandbox, be in the sandbox, build whatever it is, and then they want to fund the testing. So funding agencies is a little challenging, although I will say that the NSF, National Science Foundation, they tend to fund more ideas. They're the idea generator, and then NIH wants to fund the testing of the ideas. If you are interested in getting more involved as a nurse informaticist, I would really encourage you to look in the literature, find out who the folks are that are writing about it, what they're doing, and where they are. You want to begin following their work, find out where they're doing their presentations. Where do you need to be to get more involved? We also encourage you to do web searches. That will tell you a lot about, once again, who's playing in the area, who's doing work in the area, what they're doing, and how they're doing it. I think that probably all of us on this call, we probably frequent the same conferences. So obviously we attend HIMSS, which is a great place to meet others that are doing similar work. But there's other organizations too, where you will find individuals who are doing more informatics type work. Also, we, of course, invite you to engage in some of the work that we're doing, that Melissa and I are doing. So, Melissa, would you want to say more about that?
Actually, we have a question that I think, and this from the audience, who's observed that many of the open job positions in health tech mobile apps that are primarily responsible for stages 1 to 3 look for more technical experience or more formal user interface education. How can nurse informaticists get an edge for those positions over business system analysts or other user interface designers?
Would you like for me to entertain that question, Melissa? Is that your plan?
That's a good question.
Well, it really hits at the heart. The question really hits at the heart of probably the hurdle, and that is, when in the early stages in the planning and the requirements and the design and prototyping, I do think that the default is to assume that everyone in that stage needs to be programmers. They need to be engineers who can offer the technical assistance. And it's just simply not true. The persons that are doing the coding, the persons that are doing the actual technical work, they have to be guided by those who know what the end product needs to be. they've been doing enough work, and I'm referring to they, and that's a very vague term, but whomever it is that typically serves on development teams, they might very well have done enough work that they have a sense about what the end product is, but there is no way that they know what the problem is, the true problem is, and how the mHealth app is resolving the problem, or if not resolving it, at least helping to alleviate some of the problem. So, I think the real issue here is that once again, here we are as nurses, and we have to help folks understand the value of us being involved. And it's not just on the front end, how these applications work, what information is in them, how they function, how you navigate them, but also on the back end, especially if you're an informaticist and you understand all the systems that have to be navigated and have to be interfaced with this mHealth application. What I would like to see, what I think that we're promoting in our small group that Melissa and I are co-chairing, is we need to get the word out. We need to be in the literature more. We need to be developing standards. We need to be describing who should be on a development team. What are the roles? What are the responsibilities? Even using a model like what Melissa just had on the screen that shows you the different activities that are occurring in the different stages. I'm not even sure that that's common knowledge. So if we can get the information out about the standards for app development, then there's no reason why we can't be describing the roles, who should be in those different stages, and their roles and responsibilities. I don't have an immediate answer. What I do have to say is we've got a lot of work to do. We've got a lot of writing to do. We have to talk a lot about this. We have to be in on the front end of all of the activity and build that's happening, and not on the back end or on the periphery.
I do agree with you, although if it seems hard to get into those conversations, kind of getting yourself more involved in opportunities. So looking for think tanks and working groups, and in the Chicago area, organizations like Matter. I don't know, my brain's a little medicine heady from my cold. I think that's the right name of it, where they encourage and actually have some education about, or they do talks about, it's like a feeder for startup. It's in the Chicagoland area. And with your ideas or other people looking to work together, you might find some opportunities to if not necessarily get your hands on things, at least start the conversation to understand what those technical things might be to help build your skill set, if that's the direction you want to go in. I hope. And no, they're not paying for me to say that, because I can't remember if that's really the name of it, but yes, things like that. But other groups that are more informal are probably another way to look at, kind of build up your skills. We have another question. Somebody who's new to the Masters of Science in Health Informatics as a graduate, finding it challenging to marry many years of nursing with informatics, looking for suggestions on how to get involved with hands-on mentorship. Lacking the technology experience. Again, looking at those groups. It's often, it's funny because I said to a colleague, I thought, because I'm sort of in that boat, more my experience after 20 some years in informatics, I would say I'm not that technology heavy. My experience is not, but really, I thought, should I go back to school for some more of this technology? But I was told stop with the schooling. And there's really just opportunities that are more informal gatherings. HIMSS, you could work through, that's more of a structured piece, but there's so many interest groups and areas within. I will give credit for my first, after I graduated with my master's in nursing informatics, through the job mine, went to a conference and it was just a near miss. Saw their postings and whatnot, and didn't think anything came out of it. But 6 months later, they were like, well, if you're still interested, I have an opening. And that was my first step into the world. So it's not directly from HIMSS, but the platform or the organization and the outlets that they provide may open that first door for me. We are also looking for mentors and mentees at the Greater Illinois chapter of HIMSS. Please see our website or message me afterwards. Our membership chair works on that.
So Melissa, I'd like to add just a few words to that. I'll tell you my background. How I really got involved in this is that I have a degree in instructional technology and instructional design. And so I began to feel really comfortable being able to talk the healthcare part, and then also being able to talk to the technologists. And I think that actually that is precisely what a nurse informaticist often does, is they're the liaison and they help translate the information that's needed. And so I think it's really difficult to penetrate industry. They have a different work ethic, environment, meaning they're on the clock and they're spending all of their time to do that. I think it is easier to penetrate an academic center. So if you happen to be working in a facility where you are an academic institution, you should be able to fit in and navigate your way into work groups or task force. Spend some time with your IT department. Find out, are we developing applications? And it may not be that you're really interested in health applications, but get to know the IT folks and find out who are the members that are making decisions, who's doing the work. I would integrate myself that way. And it's just easier typically to get into an academic setting and a university, because our job is teaching. And so you welcome the opportunity to have new people come in and get involved in the process. I also, just as Melissa said, I would make sure that I'm attending the right organizations, because there's always working groups and task forces that are looking for volunteers and able bodies to get more involved. And the more involved you get, the more you learn. And sometimes it is trial and error, or in the South, we say baptism by fire, but it is one way to get involved and be learning along the way. That's what I would offer as suggestions about how to really penetrate. I don't think you have to go back to school, formal education, although if you feel that you need it, do it. But perhaps you can put off making a decision about school until after you get involved. And then if you get involved and you realize that you really are missing some key skills, then that may require you to go back, or a certificate or something else.
Thank you. So what else can we do? Well, we were thinking, if you've heard of Nurses on Boards Coalition, it's really just an interest group that is based on the opinion that nurses should serve on more boards. And so they actually help to tell nurses about these opportunities and, and celebrate when nurses are on boards. Kind of that idea, we were thinking about creating a Nurses for mHealth group network, so that opportunities are brought to light and interested parties could join in and look into that. So if you're interested, if this appeals to you, we haven't created anything yet, but we wanted to know if you are interested, and if you are, please join us. We want to talk it up. Presentations, white papers, some social medias, publications. We want to let everyone know because this is how we're going to build that.
Well, I want to thank you both for this wonderful conversation. Thank you to all of the participants. We are at time and we want to be respectful of your time. This is a fantastic program. Please refer to the recording if you'd like to check back on any of the slides or anything like that. And do reach out on LinkedIn if you have any questions for any of the panelists. Thank you again, and fantastic presentation. Have a wonderful holiday to everyone and Happy New Year.
Thank you.